Welcome to SDAHO's Soundbites, short audio clips that focus on specific topics from our webinar sessions. Today's soundbite comes from our February Medication-Assisted Treatment webinar.
What about dosing strengths and weaning off opioids safely? So if someone does come in withdrawal, I believe there is, or from what I've heard, a process to sort of step up and down at the same time. Is that right?
Yeah, so, typically dosing on this, if we're talking about Suboxone or Subutex, the standard tablet formulations are an 8 milligram tab with or without the naloxone in it on the side. But if we're just talking about the buprenorphine, the 8 milligram tab is typically the standard one that I would be using for patients with opioid use disorder. There is a smaller strength, a 2 milligram tab, which we use a lot as people are coming down on their buprenorphine dose, if that's appropriate for them, if that's something that they would like to do. But the 2 and 8 milligram tabs are the most commonly used. Typical doses that I would see for somebody with opioid use disorder is that 8 milligram tab dosed 2 or 3 times in a day. So that's kind of the standard dosing that I see for most of our patients down here. You talked a little bit about kind of having patients moving from, if they've been on morphine or hydrocodone and they're really interested in getting off that medication and moving over to buprenorphine. There is a really nice way now we call it microdosing, where they would maintain their current dose of opiate at the same time that we're starting very low doses of buprenorphine, just to give their body some time to get used to it. And as we build up that buprenorphine dose, then we can start taking away their opioid. They tend to not feel any withdrawal effects whatsoever. Telling patients that that's not going to happen is the hardest part. There's a lot of mistrust about that because they've perhaps been through some withdrawal. It's an awful thing for them to go through. They're scared to death to go through it. And so some of it is just counseling them and kind of what to expect and assuring them that you're going to be checking in with them as we're bringing that dose down, but reminding them that as long as the buprenorphine is getting into their system and it's sitting at those receptor sites where they're supposed to, they're not going to feel that withdrawal that they're so afraid of.
To listen to more SDAHO Soundbites, visit us at SDAHO.org.